Okay, yeah, first of all, I'm doing this work as part of the Amplifying Public Value project with Axel and Jean, and also working with a colleague in Canada, Alice Bleerackers at Simon Fraser University. Yeah, firstly, research preprint, so preprint publications, and that's publicly available research papers that have yet to be peer reviewed. They skyrocketed in the first half of 2020, and this was because of COVID-19 research. So within the first 4 months of the first confirmed COVID-19 case, over 6,000 COVID-19 related scientific articles were posted on preprint servers. And media coverage of these preprints also increased dramatically in the first half of 2020. And this led to scientific and media associations becoming increasingly concerned about the rise of public attention on preprint research. Because on the one hand, covering this uncertain science provided timely relevant findings where there was this information vacuum. So any information was important for people making decisions, and there's always complaints about science taking too long. But on the other, the unverified nature of these findings could mislead audiences if the scientific uncertainty of the research was not made explicit, or if potentially flawed research findings were interpreted and established as facts. Some of these early preprints have been removed, they've been pulled, or are still waiting to be published over a year later. So they've continued to have a very uncertain status as knowledge. So in some early research that I did with Alice in Canada and colleagues in Canada and the US, we looked at the 100 most cited preprints posted on medRxiv and bioRxiv, and they're the two most widely used preprint servers. And this was from the 1st of January to 30th of April, so those first few months after the first COVID-19 case. And we found that The Conversation was one of the top 15 outlets publishing preprints. And The Conversation published 41 stories linking to one or more of the most cited 100 preprints at the time. And after conducting some content analyses, we found that fewer than half of these preprints included framing devices describing the preprint research as scientifically uncertain or contingent, so just over 40%. And these linguistic strategies of uncertainty included identifying the work as preprint research, qualifying the findings as preliminary, describing the study as not peer-reviewed, or stating that it needed verification. And the lack of this scientific uncertainty framing by this outlet was surprising to me, given that the official terms and conditions of The Conversation specify that research as a general principle should not be reported before it's been subjected to a recognised process of peer review. So we're seeing some tacit, perhaps revisions of editorial policy around these early times. And understanding The Conversation's coverage of preprint research is important because of the outlet's focus on providing evidence-based content that non-academic audiences can use, and also the potentially expansive reach of this amplifier platform that Axel talked about for those who are in the 1:30 session. Content can and is freely republished by other media outlets, so it's repurposed, and it's in Australia going far and wide and growing. So this project looks at this issue more closely of how studies are presented, this contingent science. And we're particularly interested in how these conversation stories that include preprint research were being amplified through social media. So 3 research questions, starting with a close look at the conversation articles themselves, and then moving to look at social media engagement with those articles, because there's been very little research around that. So firstly, are there identifiable patterns in the content included in The Conversation COVID-19 preprint articles and the presence of markers of scientific uncertainty? So do we see relationships between issues-based, time-based, anything else? Who's sharing The Conversation preprint articles on social media? Are we moving beyond academic communities, which is important to think about for scientific literacy and critical literacy? How were social media users engaging with the scientific content when posting about The Conversation preprint articles that contain contingent research claims? So I'll talk about some of the preliminary findings of that work. So firstly, research question 1, are there identifiable patterns in the content included in the conversation COVID-19 preprint articles and the presence of markers of scientific uncertainty? We didn't identify any significant relationships over time or topic when we looked closely at the content of these preprint conversation articles, but we found that the authors of the articles were more likely to use markers of scientific uncertainty when they presented the findings of preprint research negatively in the article. So all authors who were critical of preprint research findings related to COVID-19 included one or more of the scientific uncertainty markers that we investigated earlier. Sometimes they use them all or four. When authors use preprint research to support their claims, so in a positive way, and this happened more often, they were less likely to include linguistic markers of scientific uncertainty. And we know from previous work that journalists, authors only use scientific uncertainty when there's a purpose. They use it purposefully. So here's some examples of the articles, the extracts. So the first one represents what we see as a positive representation of preprint research without including those uncertainty markers. So there's a claim made and a hyperlink to the preprint. And you can see that the claim's what's highlighted. That's what is highlighted as evidence. Example 2 shows how preprint research is presented positively, but with scientific uncertainty of the study acknowledged. But interestingly, when authors presented preprint research positively, but with a nod to the scientific uncertainty, they highlighted other positive attributes of the study. So things like the large size of the study, it was over numerous countries, it was a nationwide survey of a large population of people, the prestige of the organisation. So the example here is Harvard, and you can see that's what's hyperlinked, or the urgent nature of the research. So explaining that the results have been released before peer review because it's really important people know about this. Some authors downplayed the uncertainty associated with the preprint study by describing it as currently under review when they were using the research positively, rather than saying it was not peer reviewed or needed verification. So in contrast, you can see the final example here, when preprint research was presented negatively, so when it was criticised or used to criticise preprints in general, the uncertain nature of the science was often highlighted in the hyperlink. And there's an example of that here. So we also wanted to know, research question 2, if these articles are moving beyond academic communities on social media. And this is important because if social media audiences are scientifically literate or research literate, there is an assumption that they'll go back to the original source publication or do their own research before taking a claim at face value. So we use the Facebook public insights tool CrowdTangle to pull the Facebook posts that shared links to the stories, those 41 stories from the conversation, on public groups, pages, and verified profiles, so public spaces. And we identified 315 public Facebook posts that included links to one of those 41 conversation stories that included preprint research. So first, some metrics data. The official conversation Facebook pages receive 15% of the shares, 30% of the comments, and 10% of the reactions on all the posts, these 315 posts we found, sharing those conversation preprint articles. So there's a lot of Facebook spaces outside of the official conversation pages that are sharing these story links in original posts. Facebook engagement with these posts also appears to be issue specific and not related to the way that the preprint research is presented in terms of uncertainty or the way in which the claims are made positively and negatively. So here the red colour indicates whether the preprint research is presented negatively or positively, and the C and U in brackets indicates the presence or absence of scientific uncertainty markers. So a mix here. So you can see some of the popular articles are about links with obesity and COVID-19, hydroxychloroquine, of course, wildfires in Australia, going back to school, the reopening, and also what to do if you're asymptomatic but got COVID. So from now on in this presentation, I'm going to focus on a manual coding that we've done on 120 of the 315 posts. We randomly selected these 120 posts as part of an intercoder analysis process, and another coder and I coded the sample to identify who was amplifying these media stories and how they were communicating about the uncertain nature of this early COVID research. We just finished the intercoder work last week. We got good intercoder reliability on all categories, so above 0.8 using Krippendorf's alpha, and we're finishing off the rest of the coding in the next couple of weeks. So out of those 120 posts that we looked at, over half Facebook users sharing those preprint article links in our sample were citizens. So we coded them as citizens rather than being associated with particular professional or organisational categories like academia, media and health. So we went in and looked at the bios, we looked at the posting rules, and got a sense of who these groups or these pages and profiles were connected to, and yeah, they were mostly posting to groups rather than pages or public profiles. So they post to groups. Most of these Facebook spaces didn't provide political identification information, and I've been in some great sessions talking about some of this political identification work during the conference. So in their bios and the posting rules, we didn't see much political identification information. And you can see some of those who did provide information describe themselves as this is an apolitical group or we're bipartisan. So I think, yeah, some of the work that Axel's doing around media consumption is important here, because I think just because people don't put this in their bio doesn't mean there's not a political orientation. So more work to do around that. But anyway, we then coded the Facebook posts for their rhetorical purpose and any indications of scientific uncertainty. So we looked at these posts themselves. And as I said, we've looked at 120 of the 315 so far. So Facebook users mostly reshared posts with these article links from the conversation without comment, so reshares, or they shared posts that included limited scientific uncertainty. So the markers we talked about, but there's a lot of research also on the heuristics people use to assess the quality of health research information. So they give people a bit of research to read, and then they ask them, you know, how do you rate this in terms of its validity as evidence? And they found that many of these heuristics associated with establishing scientific uncertainty, so things like endorsing science unconditionally, believe in the science, or triangulating evidence from their experience with other studies, things that they know about, or focusing on the numbers and statistics. And we found some of that when we looked at those posts. But in using heuristics, users might also point to study flaws or weaknesses to emphasise uncertainty, and we found very few instances of that. What we mostly found was that these Facebook posts contained claims consistent with the conversation article claims, and also contextualised in the posts. They contextualised these claims for their imagined followers. So, you know, an example would be, this article is an interesting read for parents. Kids are okay to go back to school next week. Facebook users posting these preprint articles rarely included recognised markers of scientific uncertainty, the ones we looked at earlier, and when we looked at epistemic modal verbs, so those that indicate a lack of certainty, we found few of those as well. We'll do some more work on that, but could, may, might, so very limited information on scientific uncertainty about preprint research. So, preliminary findings to date, the conversation reporting of preprint research claims positively or negatively was related significantly to this inclusion or exclusion of markers of scientific uncertainty, Facebook user engagement with the preprint conversation articles was issues-based, so things like COVID-19 risks, spread, containment measures and cures, and engagement was not related to the scientific uncertainty communicated about the research. Citizens, often in Facebook groups, and we're seeing that these groups are geolocated, so neighbourhood groups or issue-based like health information sharing groups. These were this is who was sharing those preprint articles. Facebook users mostly reshared posts with the conversation preprint links without comment, so reshare or shared information that indicated limited scientific uncertainty. Obviously, we need to finish the coding of these posts before we can say anything definitive, but it seems that scientific uncertainty, if present at all, was not a topic that arose when talking about this preprint research. Some limitations. The study was limited to the top 100 most cited preprint articles published in the first 3 months of 2020. And this time mightn't be representative of what has happened since peer review has caught up with COVID-19. We've got a lot more peer-reviewed research coming out, so it may be different. The study does not include the conversation content republished by other outlets, and it focuses on public Facebook spaces, so no data on private Facebook spaces besides that engagement data. But by including the conversation reporting of preprint research for 2020 and social media engagement with these articles, we can look at changes over time and the relationship of scientific uncertainty around particular issues over time. Perhaps there's something there. And we plan to do some cross-platform analysis, so comparisons with Twitter. We developed a Twitter code book to complement what we're doing with Facebook, and we'll start coding tweets as soon as we've finished with the Facebook set. I'd like to give a big thanks to Alicia Rodriguez at QT's DMRC for assistance with coding in this project. Thank you to our fabulous funders, and also to CrowdTangle for giving us access to all of this wonderful data to work with.